ankle replacement, like most orthopedic surgery, takes months to get to the final end result. But the earlier recovery is actually a lot quicker than an ankle fusion, which is the alternative. So generally with an ankle replacement, we will let the patient weight bear pretty much immediately in a boot. First week to 10 days, obviously they need to elevate, get rid of the swelling, try and stay off it, but they will be able to walk. So people will be in a boot for generally about 6-8 weeks, gradually coming out of it. So the first 6 or 8 weeks are the real recovery process, and then after that, it's getting the strength back and getting back to normal. With modern anesthetics, most orthopedic surgeries now not particularly painful because the anaesthetist will use blocks around the time of surgery. So when most people wake up, they will be numb, pain-free after surgery. By the time the local anesthetic wears off, most people have discomfort rather than pain. So they'll take painkillers for a few days, maybe longer, but it's not usually a particularly painful procedure. Okay, so ankle replacement surgery is a relatively new procedure. It's been around, they've been trying to do it for a long time, but it's only over the last 5-10 years that things have really become where it works well. Most of the literature suggests about 85% of people at 10 years are still very happy and still got the ankle replacement. But I think with the newest generation of ankle replacements, it's probably slightly higher. But the majority of people with an ankle replacement for the right reason will be very happy. I'd say probably about 90% of people will be happy. Complications can occur with any operation, but most of the problems with ankle replacements, if they will happen in the first few weeks, if they're going to happen. If you get through the risk of infection and the bone healing, generally people do very well. Is it a major surgery? I guess it depends what you classify as major. It's not a high risk operation. It's not a particularly life threatening procedure, but it's a big surgery. Any surgery is big for a patient because it means that they are going to be out of action for several weeks. They're going to have to spend a bit of time off work with their feet up. But it's not major in that they will be able to walk straight away. The big risks to sort of life and limb are very small, but it's like any operation. If you have one, it's big. The reason for doing an ankle replacement is for pain. So generally, people that will decide to go down the route of an ankle replacement will have fairly significant arthritic pain in their ankle, which limits their mobility. They won't be able to walk long distances. So the decision to go ahead with surgery is to try and get rid of that pain and get things back to normal activity. So it's weighing up pros and cons and risks to the patient and how much your pain is. But generally, when people decide to go with surgery, that they are in a significant amount of pain, and if it's successful, they will get back to walking long distances, playing golf, whatever they used to do before. So from that point of view, it's very much worthwhile if everything works out well. And majority of people will find complete relief of pain and get back to all their pre-injury activity or the pre-surgical activities. There are two operations that are available for end-stage ankle arthritis. So ankle replacement, which we talked about. The other one's an ankle fusion. So an ankle fusion is we actually join the tibia and the talus together, so there's no movement and no pain. And there are certain things that we use to try and decide which one's best for each patient. So in a young patient, when I'm saying young, sort of 30, 40, 50, if you do an ankle replacement, it will wear out during their lifetime. And then you need further surgery, revision surgery, which is bigger. So we tend to use ankle fusions in the younger patients because they're more likely, to keep them going through retirement age. If the patient has already a very stiff ankle, it's almost fused already, and they will usually be quite happy to have it fused just because they're used to having a stiff ankle. Whereas the patients who have got very good range of movement and arthritic ankle are much happier with an ankle replacement. So there are various things to help decide. The other things will be the patient's soft tissues. You know, if the previous scarring, if their skin's not good, then a fusion may be the better option because you can do that arthroscopically. So there are a lot of things we take into account when deciding. It's not an ankle replacement. It's not for everybody, and an ankle fusion is not for everybody. It's a very much a decision that you have to do based on the patient, the X-rays, and their examination.